Hi, I'm Dr. Joe Alamat. Today I'll be talking to you about wisdom teeth, also known as third molars. Some people ask, do all wisdom teeth need to be removed? I'm 50 years old, I haven't had my wisdom teeth out, or why is it my teenage son is having their wisdom teeth removed? That's what we're going to go ahead and review for you. Through the process of evolution, our jaws have gotten smaller through the years, and even though the jaws are smaller, we still have the same number of teeth, which is 32. Although now with evolution, we seem to be missing some teeth, so some people do not have their wisdom teeth. But when you were able to chew heavier foods or unrefined foods as a Neanderthal or hunter-gatherer, they were needed with the bigger jaws. But now, as our diets have changed, our jaws have gotten smaller, and now there is typically not enough room to accommodate the wisdom teeth. So what ends up happening right around the age of 15 to the age of 21 or so, the wisdom teeth will try to erupt into place, oftentimes after you've completed orthodontic therapy. The problem with that situation is as they tend to push forward, they'll crowd their lower front teeth or may crowd the upper teeth there. And a lot of people want to try to avoid that, and so they have their wisdom teeth removed to avoid ruining any kind of orthodontic work they've had. As these wisdom teeth come in, they'll be stuck halfway inside the mouth and halfway inside the jawbone. And so as you eat, you'll tend to impact food around these wisdom teeth, and it creates this ongoing, non-stop inflammation in the mouth. The problem, as we discussed earlier, is ongoing, non-stop inflammation in the mouth causes a bacteremia, which means every time you eat or brush or floss, that bacteria is entering your bloodstream. That tends to bind with the cholesterol, small cholesterol particles, also known as the LDL particle, and it seeps into the arterial walls and causes inflammations. Or the P. gingivalis, or certain types of bacteria around that wisdom tooth, as it enters the bloodstream, it deposits in areas of joints, and it may trigger rheumatoid arthritis or many other diseases. And so this ongoing, even though it doesn't hurt, it's not really a reason not to address it. If there's an actual infection, then we go ahead and address it. Other reasons to take out wisdom teeth is if they're stuck inside the jawbone, a cyst could develop around it, a tumor could develop around it. You could start destroying the tooth in front of it by matter of pressure or decay or what have you. So again, do all wisdom teeth need to be removed? The answer is not necessarily. However, I would probably recommend getting a panorama x-ray done at your dentist to evaluate whether or not there's actual pathology or problems there around that wisdom tooth if you have not had your wisdom teeth out. And this x-ray should be repeated every 5 years. Number two, if you're in the earlier teen years, you probably want to get a panorama x-ray and evaluate whether or not there's room for these wisdom teeth to come in, or if they will tend to cause trouble or problems. Because the older you get, the harder it becomes to take them out.